And joining us now is one of the leading experts on coronavirus vaccines, Dr. Stephen Thomas with Upstate University Hospital in New York. He is also one of the lead principal investigators for the Pfizer clinical trial. Dr. Thomas, always good to see you. Thank you for your time.
Thanks for having me back.
I want to start with an email I just received, and this is breaking from the FDA reacting to the proposal that people get a half dose, essentially, of the vaccine to get it in more arms. They say at this time suggesting changes to the FDA authorized dosing or schedules of these vaccines is premature and not rooted solidly in the available evidence. They say we need more data. Medically, your response to this proposition?
Oh, I agree with the FDA. I mean, I think the first thing you need to look at is why have we not seen as many doses administered as we would like? Is it a vaccine shortage, or is it the challenges of distribution and administration? And I think really it's the latter, and that is not a criticism. This is something that we haven't done before. So we're flying the plane as we're building it. In terms of the data that would support a single dose, it is true that the results of the phase 3 trials from both Moderna and Pfizer do indicate some level of efficacy after a single dose. But so many people received the second dose that it is we are unable to tell whether or not those effects would persist beyond that 3-week period or 4-week period when the second dose was administered.
Does this impact, having this debate right now as we wait for more vaccines to go out, have an impact on the confidence of the American public to get this vaccine as they wait for more to become available?
I think changing the course would certainly impact confidence. It is clear that there is some level of hesitancy out there. And what is going to allow us to overcome the hesitancy and to get more vaccine into more arms and try to pursue that vaccine-induced herd immunity that we want to do, what's going to allow us to do that is by generating high-quality data. And the high-quality data that has been generated shows that 2 doses separated by either 3 weeks or 4 weeks is safe and highly effective. And we have to stick with that plan, in my opinion.
Dr. Thomas, the discussion really that we're having is a result of the fact that we have had a lot of vaccine distribution issues. I mean, at this point, the government has distributed 15.4 million doses. About 4.5 million Americans have gotten it. It is well shy of what the goal was initially. What are some options for solutions to get it to more people more quickly?
Well, clearly, I think that we have to get these doses to places where they can adequately store at the temperatures that these vaccines need to be stored. As they open up the priority lanes, if you will, of people who can get the vaccine, that will also help. Remember, we've had a very staggered approach with high priority populations going first. Number 3, as I mentioned, I think we are learning more every day how to administer the vaccines, how to get more people through the vaccination process, and how to do it safely. Remember, we still have a pandemic going on, so people still need to be wearing masks. They still need to be socially distancing during this process. And so it's not like our flu drives that we do every year where we can have thousands and thousands of people come through a hospital, in the case where I work, and get vaccinated. So these are some of the things that I think that we can do to improve the process.
Are we also learning more about the vaccine as more people have it and more people prepare for that second dose, about how effective it is and for how long?
Well, that's certainly being measured, but the data we have is still from those 2 trials, which account for over 70,000 people vaccinated. And again, remember, those trials measured efficacy after just a few months, but these are trials that are going to go on for 2 years. And so we continue to measure whether or not people are getting sick. If they're getting sick, we're determining whether it's COVID or not, and the companies are still amassing all of this information. So I do expect that in the first or early in the second quarter of next year, the companies are going to come back to the FDA with more data, longer-term safety data, longer-term efficacy data.
And what are you hearing finally about how close we are with some other vaccines to come to market?
Well, we do know that the AstraZeneca and Oxford collaboration, that their vaccine has gotten the nod in a couple of countries. I think that, those vaccines are the basis, especially in the UK, for some of this discussion about delayed second doses or fractional doses. Novavax has started their phase 3 trials. So this is good news, because we have, over 7 billion people on the planet. No one was immune to this disease before it started about a year ago. And so the more vaccine candidates that we can demonstrate to be safe and effective, the better chance we have of getting through this pandemic in a timely manner.
Doctor, always good to talk to you. And just to reiterate your point, you agree with the FDA that stay the course on the current vaccine schedule?
Absolutely. Thank you.
Appreciate your time. Thanks.